always walking with my donkey, searching for you.
Can't deal with blood and things like that, especially before lunch. You might want to consider exiting. So the objectives of this talk, and I did fairly detailed notes which are available on Hoover, is not to teach you how to castrate donkeys, okay? And we're not going to go into every detail of surgical technique and so forth. What I do want to do is give you an idea of the anatomy that's involved, and as we discuss the procedure, you'll see why that's important. Why do I have to know anatomy? Why do I have to know what the epididymis is? Okay, well, there's actually a reason for that, and we're going to talk about that. We're going to mention a state called cryptorchidism, which simply means the testicle is someplace besides the scrotum. We're going to talk about ligation technique, because the use of ligatures in castrating donkeys is much more important than it is in horses. We'll discuss the reasons for that. A ligature is basically just suture material tied around something to keep it from bleeding, or to seal it, And then we're going to talk about the complications that are associated with castration, swelling, bleeding, what's called a scirrhous chord. We'll talk about what exactly that is in a minute. Evisceration. And to be technically correct, it's actually called eventration. That's when the intestines come out through the inguinal canal, and it is every equine surgeon's worst nightmare. What's meant by proud cut? That is, the male stallion or jack exhibits stallion-like behavior after they've been castrated. And then finally, a condition called hydrocele. And again, we'll get into exactly what that means in a minute. So, okay, I'm going to abuse you with some anatomy here. This is not insignificant. And by the way, my comments are going to be of two kinds. Some are going to be my personal opinion. When a comment is a personal opinion of mine, I will say that. When it is backed by objective research, I will point that out too, because it makes a difference. Surgery is a field where there are many very strongly held opinions and often very little proof. So, you know, in this world where proof and facts seems to be kind of like not of much interest, I'm kind of a stickler for that. So I will make a point. Anyway, this could be a stallion or a jack. Testis here. This tube called the vas deferens goes to the base of the bladder and then into the penis. And so sperm starts here, ends up there. Pretty simple and straightforward. With magnification, I want to concentrate on some of these structures. The testis, which is what you're trying to take out in a castration, does two things. One, it is full of little tiny tubules, and on the inside of those tubules grow the sperm, which obviously transmits the genetic material that causes a fertilization in another copy of whatever species you're talking about, in this case, donkeys. It also contains cells that produce the hormone testosterone, and testosterone has several effects. One is that they have effects on the size and conformation of the body, more bone, more lean muscle mass, that sort of thing. certain other sex characteristics, particularly in horses where you have an enlarged jowl and crest and that sort of thing. They also affect behavior. They affect behavior interactions between males, they affect libido, and they affect breeding behavior. So the fact of the matter is, horses are castrated not so much to get rid of the sperm factory, because you keep animals from breeding, or horses at least, and donkeys from breeding by building a fence. And you have the males on one side and the females on the other. It's pretty simple. But because the behaviors that are associated with testosterone make it difficult to deal with animals, particularly in the way in which we use them in this country, where we work in places like Mexico and Nicaragua, many jacks and stallions are not castrated, and frankly, they don't need to be. They're worked with every day, they're very well trained, they behave themselves, and they don't hurt anybody. And obviously that differs, but given the culture of equine ownership in this country, generally most males are castrated. So anyway, sperm forms in the testis. It goes to the head of the epididymis, and this is full of a bunch of little tubules. It goes down the body of the epididymis. It goes to the tail of the epididymis. The tail of the epididymis is sort of like college for sperm. So they mature there and eventually will be moved into the vas deferens, which is that tube right there, which then ends up in the penis as the ejaculate. There are some other organs, a prostate gland, seminal vesicles, that are part of the reproductive tract. We're not going to bother with those because they don't really have much to do with castration. So just to be clear on that. The epididymis, the head, the body, and the tail, do not, have not, and will not secrete testosterone. They don't do that. So technically, if it was possible, and I don't know why anybody would, but if it was possible to simply strip the testis loose from all those structures and simply remove the testis, and you were to leave particularly the tail of the epididymis in, the animal will be a gelding. Okay? That's not my personal opinion. That's long, I mean, that's been known for well over 100 years.
Would you repeat that sentence again? Your fact, what did you say?
The tail of the epididymis does not, under any circumstances, produce testosterone.
Right.
It doesn't have the cells to do it. There is a myth, I suppose, misconception that if you leave this in, it's called the squealer sometimes, or the button, that the animal will be, as they say, proud cut, which means they're castrated, but they behave like a stallion or a jack. That is not true. And again, that's not my opinion. That's proven fact. So we're going to go ahead and move now to looking at a diagram of the male animal cut through the pelvis. You can see the left leg, the right leg there. This is as viewed from the rear end. Sort of, if you were a little piece of donkey poop falling through the air, that's what you would see. I feel like that sometimes. And you can see there are obviously two testes. There is an inguinal canal here, and then a spermatic cord on both sides of the penis. The important part of this is that you'll notice this is the abdominal cavity. Intestines, bladder, cool things like that. It is lined with a thin membrane that's called the peritoneum. And that peritoneum goes down through this inguinal canal and forms this little sac that holds the testis, and it is referred to as the tunic. So when I'm talking about the tunic, that's what it is. It is a extension of the peritoneal cavity that holds the testis. Okay. You will notice that the inguinal canal, which is kind of long in horses relative to other animals, say humans and pigs and dogs, which have sort of a short, straight inguinal canal. Horses have a relatively long one. There is a small internal inguinal ring, which allows the blood supply to exit the body and go to the testis. It also allows the vas deferens to go back into the abdomen and get to the base of the penis. It also keeps the intestines from literally coming out of the body and causing what we would refer to as an inguinal or scrotal hernia. So when intestines go through this hole, that's a hernia. Okay, an inguinal hernia. There's other kinds of hernias, but that's an inguinal hernia. There's a larger external inguinal ring here, and the inguinal canal is between the internal and the external inguinal ring. So I want you to kind of fix that in your mind because it becomes important as we continue. So here's an actual testis. You can see the testis here with those very characteristic large blood vessels on it. Let's face it, guys, life is all about reproduction. And so the body of pretty much anything is constructed to do one thing at all costs, that's reproduce. So the testes have plenty of blood supply. There's some of those big vessels there. Next to the surgeon's left thumb here is a structure called the pampiniform plexus. Just think of it as the blood supply to the testis. Okay, a little more complicated than that, but that's basically what it is. Then there's this sheet of tissue here that's called the mesorchium. A mesentery or a meso is a fold of tissue that carries blood vessels. Orchium is, I don't know if it's Greek or Latin, sorry, I'm not that well educated, but the mesorchium is the mesentery for the testis, and you can see it's carrying more blood vessels, nerves, and so forth. The head and the body of the epididymis is on the other side of the testis, but there's the tail of the epididymis right there, and coming out of it is our friend the vas deferens, going back down into the body, through the abdomen, to the penis. And this structure here is referred to as a spermatic cord. And that's what you're going to cut when you remove the testis. Okay, is that clear? Now, over here on the side, held in the other hand, is the tunic, because the tunic has been opened, and that would make this what's called an open castration. If you do a castration and part of the procedure is to open the tunic, it's called an open castration. If you, and in a minute I'll show you a closed castration, that is where the spermatic cord is severed but the tunic is not opened. Okay, that's what open and closed castration means. A cryptorchid, again, is a male animal or a testis. And the proper term is testis, not testicle, by the way. Plural is testes. So a testis or testes are not in the scrotum. That's a cryptorchid. Remember our little term orchid, meaning testis? Crypto means hidden. So it's a hidden testis, a cryptorchid. Pretty simple. There are some slang terms for cryptorchids. High flanker is one. Ridgeling, rig, or original are other ones that I've heard cowboys and farmers say about their animal for years and years and years. Doc, he's an original. That means he's got a cryptorchid testis. And that's fine. high flanker implies that the testis is in the inguinal canal as opposed to the abdomen. And you'll see what that means here in a minute when we talk about cryptorchidism. And then finally, the concept of dropping. So when a foal is born, often the testes are not apparent, or one isn't apparent. And there's a thought that they drop out of the abdomen as the animal gets older. If they're in the abdomen when they're born, there's one way they're coming out, and that's with surgery. You're going to have to go in the abdomen and get the little sucker. They're not going through the inguinal canal. What happens is in the testis will be in the inguinal canal or someplace here other than the scrotum. And as the foal gets older, it gets bigger, it becomes apparent, it starts to fill the scrotum, and people say it has dropped. So I think perhaps the term enlarged would be better, but that's what dropping is. You may have heard that term before. Whoa, I get dizzy there. I would like to acknowledge my wife once again. She puts all my slides together, so I'm incapable of doing that. Okay, so this is a closed castration, and you can see that unlike that testis I showed you before, you can barely see the blood vessels. That's because it's covered in a membrane called the tunic, and that's the tunic that we're talking about. This thing here looks like a piece of jerky, is the cremaster muscle. It basically contracts and it pulls the testis back up out of the scrotum against the body wall. It is not in the tunic, it's outside the tunic. It's basically skeletal muscle. And over here, you can see that the surgeon is removing fascia that would normally attach the tunic to the inside of the scrotum so that you can get at the spermatic cord here, sever it, and complete the castration. So this surgeon is using a finger through a little hole that they made in the tunic just to use it as a handle. So technically this is a semi-closed or semi-open, depending on how you look at it, castration. Okay. So here's a comparison. Closed tunic. You can see, you can't see blood vessels really well. Open tunic. Body of the epididymis, the head of the epididymis is kind of over there. Little sperm's going along here. Go to college, join a fraternity, whatever, and get educated. And then they move down the vas deferens, and that goes to the head of the penis. And you can see the tunic laying here. It's been opened up so that you can see that. Does that make sense? Okay. Whoa. This is just another example. Testis here, tail of the epididymis. There's the head of the epididymis. The body is on the other side of the testis. And you can clearly see the vas deferens going down here, the blood vessels, and the pampiniform plexus carrying blood to the testis. So this is what you're going to section or cut to remove a testis. So now I've abused you with anatomy. I'm going to abuse you with some embryology. So welcome to vet school. And anyway, so these are diagrammatic, obviously, but this, I think these are some important points. So in the fetus, a measly 5.5 weeks of gestation, the testis is already formed. It's right behind the kidney, one on the left side, one on the right side, because they form from the Wolffian ducts, which is an embryonic structure. You notice this little slip of tissue here, that's the blood vessels coming from the caudal aorta or going to the caudal vena cava, carrying blood into and out of the testis. The head and tail of the epididymis, the vas deferens is already formed. The vas deferens already goes to the penis. So most of your structures are formed very early in pregnancy. But the testis obviously isn't in the scrotum. It's on the top or dorsal part of the abdomen. What we do have is a ligament that goes from the tail of the epididymis to a little hole in the body wall, which again has formed in the fetus. And that is lined by this little bit of green membrane there, which is a reflection of the peritoneum. And that's going to grow up to be the tunic. It's called the vaginal process at this stage. There's a ligament that attaches that vaginal process to the inside of the what will become the scrotum going through the inguinal canal. Later in gestation, in the last trimester, the testis gets bloody huge. It takes up something like 1/3 to 1/2 of the abdomen in the fetus. It's much larger than it is after the foal is born. Why is that? Well, in the last trimester of pregnancy, the fetus is growing like crazy. It needs all those stimulatory hormones from the testes. So it is quite large. But the structures are the same. Tail of the epididymis, vas deferens, body of the epididymis, head of the epididymis. We still have this ligament, which is called the ligament of the tail of the epididymis. It's also called the gubernaculum, but we're going to leave that out because I have no idea what that means. And ligament of the tail of the epididymis, although it's more words, is frankly more descriptive. You can see that our green membrane, which is going to be the tunic, now called the vaginal tunic, is attached to the inside of the scrotum by the scrotal ligament. So as we get closer to birth, testis starts to shrink, it starts to soften. Why it goes into the inguinal canal is unclear. There are theories that range from increased abdominal pressure to motion in the fetus. Not really sure, but that's what happens. Again, you can see all these structures are still present. And it starts to slip through the internal inguinal ring. It's gotten all kind of smaller and sort of smooshy, not to use an excessively technical term. And it slides into the inguinal canal, and you can see what's going to happen. It's going to keep sliding. Boink. There you go. So about a week prior to birth, you have a testis that is outside of the abdomen. It may or may not be in the scrotum yet. It may not be big enough to see, but it's outside of the abdomen. So what happens with a cryptorchid testis? For whatever reason, the testis gets to the internal inguinal ring and doesn't make it through. Is the inguinal ring too small? Is the testis too large? Is there some kind of hormonal problem? There are a number of controversies over that, which we're not going to go into. But I can tell you, I'm in about 30 years now of doing a fair number of cryptorchids. In all those thousands of cases, I've seen that testis somewhere besides right next to the internal inguinal ring 5 times. So it's pretty rare. Technically, the testis could still be at the dorsal body wall. It just didn't ever leave where it was born. But that's very, 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 very rare. So they're almost all right there. And again, the scrotal ligament, inguinal canal. And so this testis and the body epididymis, tail of the epididymis, vas deferens, they're just sitting right there by the internal inguinal ring. Basically hanging from the mesorchium, which I don't have in the diagram. One more thing, and this is important for donkeys particularly, is that it is also possible to have what we call an incomplete cryptorchid. So with an incomplete cryptorchid, the testis stays by the internal inguinal ring. The tail of the epididymis goes through the inguinal canal because it's attached to that ligament of the tail of the epididymis, sort of gets pulled down out of the abdomen. This gets trapped, that ends up in the scrotum. And on this diagram, they don't look very similar, but I'll show you a picture in a minute where it's not that easy to tell them apart. The reason why this is important is that if you remove this and you leave that, the horse is going to have all the testosterone it's ever going to need. Okay? That's what makes most cases proud cut, or probably a better technical term would be a hemicastrate. That means a testis was removed and one wasn't. So the basic castration procedure, we use a two-incision technique. There are several different ways. Like I said, I'm not going to go into this in any detail. The fascia that holds the testis inside the scrotum is broken down. Typically, they are removed, and that's kind of a small testis right there. It is removed with an instrument called an emasculator. This side of the emasculator crushes the tissue to prevent hemorrhage. It traumatizes the ends of the blood vessels so they clot. This little instrument here cuts it. You close that and the testis is removed. So anyway, double incision. And you can see what you're looking here through the skin, you're looking at the tunic with the testis inside. Okay, we use a local anesthetic when we do castrations. We inject the cord or the testis depending on the size. This is injecting into the cord, that's injecting into the testis. The reason for that is it prolongs anesthesia because the animal is not stimulated as much. And there is some research in dogs that suggests it actually helps with postoperative pain. So we found that to be a useful technique. Here's incisions being made. Our surgeon is moving the fascia out of the way, giving a little squeeze. He's going to stick his finger in there only to use that as a handle. Little guys are kind of slippery. And he's going to go ahead and break that fascia down.
That's the tunic.
That's the fascia. I'll show you the tunic in a minute. Semi-open, semi-closed, because he made that little hole.
Okay.
All right. What we've done here is we've removed that fascia. What you're looking at here is the tunic, which is inside the fascia, which is just tissue that is holding the testis inside the scrotum. Our surgeon has done what's called a ligature. And what we're going to do as part of that ligature, we're going to do a procedure called transfixation. So we're basically going to suture the ligature, which is closing the tunic and closing the blood vessels. We're going to suture it to the cord. The reason for that is you can imagine putting a ring around a tube that could slide off. Okay, if it slides off, it's going to bleed and the tunic is going to be open. So we use this transfixation technique, and at this point you could actually cut the cord, the spermatic cord, with scissors. We happen to be using a pair of emasculators here. It doesn't make any difference. And you can see that was removed. This is an open castration. The tunic has been removed. You can see it over here. The point of doing that is ligature is going on a much smaller piece of tissue, which gives you a stronger ligature, less likely to bleed. Some surgeons prefer this. We prefer to do them closed, and the reason is I want to close that tunic because in doing so, I close the abdomen. If you don't, and you leave that tunic open, there's a hole going from the outside world into the abdomen, which could cause contamination. It also provides an opportunity for things that are in the abdomen and we want to stay there, like the small intestines, from coming out. So that's why I do closed castrations. And you'll notice here that after this is all done, we're going to pull the skin out of the way, and that's the stump of the cord. There's some blood on the skin here. I should have found a donkey that wasn't white. It shows up a little bit more. But you can see that there's no red stuff coming out of this. So we're quite sure that we've got a good ligature. Okay, so here's some notes on ligatures. Veterinarians are going to do that. It makes a difference what suture material you use. Do not use chromic or plain gut. And the reason for that is that that's an absorbable suture material, but it is removed by the body by inflammation. So you're creating an inflammatory process which can get out of hand, damage local tissue, and promote a complication that we call scirrhous cord that we're going to talk about here in just a second. We do use Vicryl, makes a good knot. It is absorbed, but is basically dissolved by body fluids. So it's like putting a sugar cube in water. It dissolves. Okay, there's no inflammatory response. We use triclosan. It's called Vicryl Plus. Triclosan is an antibiotic, and because in the field we're doing castrations, you know, there's flies and dust and this, that, and the other thing around. This helps protect our ligature from becoming contaminated. That's important because when you have an infected wound, the bacteria like to live in the suture material because it doesn't have direct blood supply. So we cheat, if you will, or insure maybe, by having an antibiotic in it. Costs a little bit more money. There's two things that I don't save money on: anesthesia and suture material. I don't care what it costs. I'm going to use the best I can get. That's why Cindy. So it's not that she's expensive or anything like that. Anyway, the knots make a difference. You're ligating a rather large chunk of tissue. I do not recommend using a surgeon's knot because they tend to slip and you tend to lose compression of the blood vessels. So it's fine if you want to do that. In my experience, you need something like a Miller's knot or one of its closely related cousins. There's, again, we're not going to the weeds here as far as surgical detail, but it's a much firmer knot. Always transfix a tube. So particularly if you're doing a closed castration, run that needle through the cord. Make sure that that ligature doesn't slip. Leave enough stump distal to the ligature, which is a basic surgical technique. If you tie a knot, cut whatever it is that you're going to cut right next to it, it tends to slip off, even with transfixation. So I want to see a good centimeter. Usually I use the width of my finger past the ligature before I'll cut the cord. You don't have to ligate. Okay, there are other techniques, but I will say this. In a couple of good control studies, ligating had no more complications than any other technique. I can tell you that it will decrease the number of particularly donkeys that hemorrhage. It's not uncommon for individuals that use just an emasculator to have to re-anesthetize the donkey to tie off a bleeder. And it prevents small intestine from going through the inguinal canal out into the cruel outside world, which is the worst thing in the world. And I had that happen on a horse once, and we got the horse's intestines back in, sent him to Steinbeck where I was doing surgery at the time, put him on the table several hours and about $10,000 later, and that was cost, okay? That was not a surgeon's fee, that was cost. We saved that horse, but at 3 o'clock in the morning as I was sitting in the recovery stall after a long day and looking at a long one tomorrow, I said to myself, I ligate donkeys, why don't I ligate horses too? And we have done that ever since, and it has worked very well for us. So that's a technique that I recommend. What makes donkeys different? Pound for pound, they've got more testis. Simple. Their balls are bigger. They store fat in their scrotum. Donkeys store fat, they probably store it in their ears. I mean, if they can put fat someplace, they will. So the procedure can be a little bit more messy because you find fat inside the scrotum. You need to get it out of the way. The fascia, which is what we were stripping down in that procedure, and the fat are vascular. Unlike horses, you can take the loose tissue inside the scrotum of a horse and kind of trim it away with scissors with a fair amount of impunity. Be very careful doing that. Be very careful doing that in donkeys, because you will get really annoying bleeders. They won't bleed to death, but if you cut a blood vessel that's maybe 3 millimeters across, that sucker will sit there and drip and drip and drip and drip and drip and drip, and the blood gets out into the loose fascia around it, and it swells up, and it makes a big mess. So just, if you're going to cut something inside the scrotum to clean it out, so you don't want to have tissue hanging down, look at it really closely, make sure it doesn't have blood vessels in it. Cryptorchids are extremely rare in donkeys. There's very little literature on that, but in my experience and in the few papers that I've seen, it's a rare occurrence. But the ones that I have seen, in fact, the 6, which isn't a lot, of cryptorchid donkeys I've seen, they were all incomplete cryptorchids. Why is that important? The reason it's important is if you're not careful and you go in there and you take out something that you thought was a small testis and leave the big testis inside the abdomen, you got a problem. And it makes the future surgery much more difficult. So remember, that's our incomplete cryptorchid. And here's an example. There's a normal testis, tail of the epididymis, tunic. This is an incomplete cryptorchid. There's the testis. Cryptorchid testes tend to be small, but this little short fat structure of the body of the epididymis in this incomplete cryptorchid is quite long. And there's the tail of the epididymis there. Testis, tail of the epididymis, body of the epididymis. So you could see, and these are almost the same size. Easy to make a mistake. If you have an animal that's proud cut, this is a cryptorchid donkey. You can see testis on one side, none on the other. Observe for their behavior, obviously. Quite often you can feel a small testis that's outside the abdominal cavity under the skin, but you usually have to anesthetize them to get an adequate feel, because you really got to get your hand into the inguinal canal, and they generally don't like that very much. You can use ultrasound on the inguinal canal. It's very effective. The testis has a very characteristic sonographic or ultrasound appearance. You can use that as a diagnosis. If both testes, if there are no testes present, there's some endocrinology you can do. Testosterone, obviously. Donkey that you thought was castrated that has a high testosterone or a high estrone sulfate, which is another hormone associated with testes. Even though it says estrone, it is associated with testicle appearance. And then finally, John Conley here at Davis has developed a technique to measure what's called AMH. So AMH is If they develop, the animal is feminine. If the Wolffian ducts develop, it's masculine. So what the embryo does, the fetus does, is it produces anti-Mullerian duct hormone because it has the genetic makeup to want to be a male. Otherwise, it would be female. And for whatever reason, male stallions and jacks continue to produce AMH throughout their life. So it's a very specific test that was developed here. Quickly, I'm going to go over the complications. By far and away, the most common one is simple swelling. In this case, what's happened is the skin healed prematurely. The incision was a little too small. We like to stretch them out to take the elasticity out of the skin so they drain. I'm not talking about draining a bunch of blood. I'm just talking about some serum dripping out. But you can see where this is swollen up. What we're going to do is simply open that up and the problem will resolve. Another case, you can see, though, that if that's not done, you can see how all this tissue around here is quite swollen. Personally, I think, though I cannot prove it, that not treating these or allowing them to occur in the first place leads to complications later on after the procedure. And one of those is our friend, the scirrhous chord. What this is, this big, enormous thing, which is, you can see the writing here, this is nearly the size of my fist. And that's simply a cord that got infected. You can see, you can see the little bits of granuloma, pus, and so forth in there. And what that does is it causes this structure called the scirrhous chord. It drains purulent material or pus through the skin and has to be removed surgically. And in my experience, these animals usually had a procedure in which there was a fair amount of bleeding, particularly if it was not treated. You get weird stuff. This is a tumor. It's actually histologically or under the microscope, it's actually cartilage, like he was trying to have a joint in his testicle for some reason, or testis, I'm sorry. It's called a teratoma. This was actually a cryptorchid surgery, and we couldn't get this thing out of the abdomen, it had to go to a larger incision, and the reason was is it had that little hard rock of tissue in there. They're very rare, but you do enough of them, you're going to see weird stuff. Every veterinarian's nightmare, this is the jejunum, or the small intestine hanging out. It's dry, dead. This animal is going to die. And hopefully be euthanized, because it's going to get horrible peritonitis and die if you don't do that.
Into the field, you can do an RNA?
No. I mean, there's this. To treat this, and actually, yeah, resection and anastomosis is what we're talking about. To treat this, what I would have to do is basically clean it up. We usually put it in a plastic bag or something like that. Take the horse to a referral facility, needs general anesthesia. This has to be cleaned and cleaned and cleaned and cleaned. You open the abdomen. You can't push it back into the abdomen. It's like pushing a piece of wet spaghetti through a hole. And so you have to reach inside and pull it back into the abdomen, do the resection and anastomosis. Everything's contaminated at this point. You lavage the abdomen, lavage the abdomen, lavage the abdomen, lavage the abdomen, and then I generally put a belly drain in them and do peritoneal lavage for several days after. And so, again, you get into 10 grand on these pretty fast. So it's difficult. I have both. One of them was a castration that I did. Others have been ones that I've treated at referral centers from, you know, you do enough castrations, you're going to see these, unless, I believe, you ligate the tunic. So, hydrocele, just quickly, what a hydrocele is that when if you do an open castration, remove the testis and leave a lot of tunic in there, the tunic heals up. And remember from that diagram, it's a little bag hanging in the scrotum. Well, that's going to fill up with peritoneal fluid, so you're going to have this little bag of peritoneal fluid bouncing around in the scrotum. Looks very much like a small testis. Leave them alone. They don't need to be removed. It's not a problem. Are you worried about it being a testis? Are you worried about it being a hernia? Feel it. If it feels like fluid, it probably is. If you want to get really serious, ultrasound will tell you to a certainty whether that's a hydrocele or not. I don't have a picture of one. They don't look like much. It's just a bump. Nice picture of the Badlands outside of Pine Ridge, South Dakota. So, it's important to understand the anatomy. Donkeys are different from horses. I believe, and there is some research to support, that ligature decreases complications. And if you do have a cryptorchid, or your veterinarian does, be careful that it's not an incomplete. And if there's some question, always open the tunic and look. If you can't find the head of the epididymis, the tail of the epididymis, and the testis, those three structures, you don't know. Distinguished Professor Benhart, not our Benhart, who is a distinguished professor here at the veterinary school and works with the behavioral aspects of endocrinology, told me last night that they'd done a study where they had compared early castrated colts to ones that were castrated when they were like 4 or 5 years old. There was no behavioral difference between the two. So castrating them earlier isn't going to change behavior that much. As a surgeon, I think it makes the procedure a heck of a lot easier. So I recommend that you castrate them kind of as early as you can. I don't find that doing a inguinal cryptorchid, that is, the testis is outside the abdomen, but not in the scrotum, okay? I don't think that's any harder procedure than doing a regular castration. But the surgeon has to know the anatomy, because if they get in there and people can't, I can't find the testis, oh my God. If you don't know how to get to the inguinal canal, they may have trouble doing it. And what we tell our students is, if you get in there and things aren't going good, wake them up, have somebody else do it. That's not the time to get adventurous. So I guess an answer to your question is, yeah, I'd castrate them as young as you can. It's a little easier to find the testes, particularly if you don't have as much experience, once you can see them in the scrotum.